According to the American Academy of Pediatrics policy statement on breastfeeding, women who do not have health problems should exclusively breastfeed their infants for at least the first 6 months of life. They also suggest that women try to breastfeed for the first 12 months of life because of the benefits to both the mother and the baby.
I haven't seen any milk come out yet, but there's just a little bit of watery stuff.
That's the first milk, and you have just a small amount because that's all what your baby needs. This first milk is colostrum, we call it colostrum, and colostrum is rich in immunities for your baby, and that's exactly what he needs. Plus, it's a kind of a laxative, and that's what is going to help clean the baby system. But even if you think that is no milk coming out of your breast, it's there, but it's exactly what the baby needs the first couple, 2-3 days.
Before you go home, we want to talk about some breastfeeding positioning. Make sure that everything's going well, your baby's latching on correctly. Okay. So first of all, we're going to do the cross cradle hold. Okay. And it's always good to put a pillow.
Comfort is so important when you begin a feeding. Have pillows all around you and hold your baby close. Skin-to-skin contact will keep your baby warm, interested in breastfeeding, and afford you a wonderful bonding experience. Proper positioning and latch-on are the keys to successful breastfeeding. There are different positions to hold your baby while nursing. These different positions prevent placing the same pressure points on your nipples and help with more even breast draining throughout the day. It is important to know the different options for holding your baby for a feeding, because this will allow you to choose which works best for you and your baby. Have your nurse or lactation consultant review positions with you before you go home. Getting the baby to latch on correctly is one of the most important steps in successful breastfeeding. The baby must open his mouth wide enough to get a good amount of the areolar tissue into the mouth. If the baby latches on to just the nipple, you will become sore and the baby will get a limited supply of milk. It is the proper compression of the areolar tissue from the baby's suck, along with the motion of the tongue that allows the milk to be drawn out through the nipple. It is important for you to know the proper signs of a good latch-on. When the baby is latched properly, you should see the pinks of the baby's lips. This tells you that the lips are turned outward rather than tucked tightly inward. There should be a tight seal between the baby's mouth and the areola. Much of the areola, at least 1 inch, should be inside the baby's mouth. As the baby is sucking, you should not see the base of your nipple, but only the outer part of your areola. Your baby's tongue is between the lower gum and your breast. If you pull down gently on the baby's lower lip, you should be able to see his tongue. With a good latch-on, baby's tongue extends over the lower gum, forming a trough around the nipple and cushioning pressure from the jaw. The tongue rhythmically milks the breast with a wave-like motion from front to back, drawing the milk from the areola and the nipple. As you see in this animation, the nipple is far back in the baby's mouth and not compressed by the gums, so it is less likely to get sore. If the baby latches onto just your nipple, as in this animation, your nipples will be sore after just 1 or 2 feedings, and your baby will not get enough milk. Eventually, you will know that your baby is latched on and sucking efficiently by the way it feels. There should be no pain. In no time, you will be assured that your baby has a solid and secure connection to your breast.
Good. Any times that you feel pain, there is a problem. Baby is just biting the nipple, so we need to break the suction and place the baby back in the breast. You want to breastfeed, not to nipple feed.
Hello, how you doing?
Good.
Good. Well, it's time to breastfeed. Okay.
Okay.
What we're going to do first is We're going to bring your gown down, and what we're going to do is have your baby skin to skin.
Research has shown that skin-to-skin babies breastfeed better and stay awake during the feeding. In addition, skin-to-skin babies have shown to breastfeed an average of 6 weeks longer. There are many reasons why skin-to-skin contact is vital for a baby's healthy growth and development.
It's good to wake them up when you're about to breastfeed. And the way to do that is by taking their hats off. They're sometimes changing their diaper to wake them up helps a lot, okay? Okay. So what we're going to do first is we're going to bring your gown down. And then we're going to put your baby's skin to skin. Right there. Is that good enough? Yes, that is great. And then you can always put a towel, a blanket right over your baby.
Okay.
The best start for breastfeeding is when a baby is kept skin to skin with a mother. The baby's sense of smell allows him to find the breast and to begin the initial latch-on. This is called self-attachment. Skin-to-skin contact does not have to be limited to the delivery room and hospital stay, but should be practiced frequently. Now experts agree and understand how important it is for a mother and her baby to be close to one another as early and for as long as possible in the first few weeks and months of life. In the early days, some babies are sleepy and do not often cry when they are hungry, so stay attentive to the cues. Watch for early feeding cues such as lip smacking, mouth opening, and hand to mouth. After the first sleepy week, crying is a late cue.
Should I wait until he cries to feed him?
No, you're gonna be watching your baby. The first sign that he's telling you, "Mommy, I'm hungry." If you see that the baby's moving, or you see his lips moving, you see his tongue, he's moving around, he's telling you, "Mommy, I'm hungry." By the time he cries, you wait too long. The first signs of "I'm hungry," you offer the breast.
Research has shown that babies, minutes after birth, begin to interact with their parents and give cues as to what they need and want. They are in a state of quiet alertness. Learning these hunger cues your baby gives is vital to help with brain growth and development, as well as helping new parents gain experience and feel comfortable in caring for and interacting with their new baby. The most common concern that you will have is if your baby is getting enough to eat. Unfortunately, there are no ounce markers on your breast for you to see the exact amounts he is taking in. This can be unnerving at times. There are many clues, though, that indicate that everything is going well.
Once I get home, how will I know that he's getting enough to eat?
Well, first thing, you had to make sure the baby eats from 8 to 12 times in 24 hours. And make sure the baby is really eating, not sleeping when you are feeding him. You're gonna hear the baby swallowing. You're gonna see that your breast is full, and once baby finish eating, your breast is gonna feel soft. And it's very, very important for you to know that your baby is giving you wet diapers and poopy diapers. And before you go home, you're gonna have a breastfeeding log. That way you have an idea what to expect every day from your baby. How many wet diapers and poopy diapers you're gonna be changing every day.
How long should he eat?
When babies are very sleepy, at least 15 minutes. But then few days later, baby's gonna tell you when he's full, and he's just gonna let the breast go. He's gonna relax, and he's just...
So he's falling asleep.
Weight gain is also an important sign that your baby is getting enough to eat.